And let's put America back to work by becoming more energy secure. Thank you, Mr. Speaker.
The gentleman's time has expired. The chair recognizes the gentleman from California, Mr. LaMalfa, for 5 minutes.
Thank you, Mr. Speaker. Mr. Speaker, I rise today to share some of the stories that fellow Californians in my district are having with the impact under the ACA, the Obamacare plan. You know, a funny thing happened on the way to government-run health care nirvana. 1.1 million Californians have lost their health care coverage. In fact, for every one person who has selected a new ACA Obamacare plan, 40 people have received cancellation notices. They find that their costs are going to increase, especially in rural California, where choices are more limited of plans, of places to seek health care. Their access to health care is being jeopardized. The law is creating a huge burden for rural health care, where, again, you have to travel maybe several hours, many miles, to seek the kind of health care you need, despite the President's promise to the public on this issue. If you like your plan, you can keep it, period, we heard. If you like your doctor, you can keep your doctor, period, we heard. This is clearly not the case. Less access, fewer choices, skyrocketing premiums is the wrong direction from the President's health care plan as promised. I'd like to share again some of the people from our district. Bill and Karina Eiler from Fort Jones, California. They write, they said, I received a letter from Anthem Blue Cross notifying me that due to the Affordable Care Act, my plan had been canceled. My new monthly premium of $919, it used to be $480 per month, a 192% increase, which Bill finds absurd. They have 2 daughters in college and 1 more at home. How are they supposed to come up with that kind of money? Tricia Plass of Tule Lake writes, she and her husband they're a business owner, they're self-employed, they've always purchased their own health insurance. Their monthly premium has been around $800 per month for both of them. Their monthly premium will now jump to over $1,000 for just one of them. They still have to determine what the other one's going to do. Now it appears they will be forced into California's insurance coverage, known as Covered California, where there are no plans with coverage for their doctor that they use now. Since they live near the state line of Oregon, they get their health care on the other side in Oregon, at facilities there, their doctors there. They will no longer be able to see that doctor. They're going to have to drive maybe 2 or 3 hours to Redding or somewhere else to find new physicians. So they live with the constant fear that their new policy will not even provide coverage when they need it. Janice Marquise from Redding writes, I recently received a letter from Aetna stating that my medical coverage policy would be canceled at the end of the year. She's 62 and must wait 2.5 years before she's eligible for Medicare. Her insurance coverage will jump from $318 a month to over $500 a month. The promise made by Mr. President Obama, if you like your policy, you can keep it, she feels was a lie. This entire program is a nightmare. Lastly, I have time. This one's really disturbing. A lady named Ramona Laramendi from Redding, California. She was diagnosed with stage 3 ovarian cancer in July. With her current plan, she was able to get the surgery and treatment she needed. A very large hospital bill of $128,000 was covered. Her insurance paid all but $700 of that because she had good coverage. Now, because she's going to be canceled, she doesn't know what's going to happen to her. She still needs a lot more treatment in this very crisis moment of her life. And yet, for her Christmas present, she's going to get uncertainty. She's going to get the worry at a time where she's being treated with stage 3 cancer of what is the health care plan that, for political purposes, it appears, since we've done everything else to try and point out to the American people and to the politicians in this building that it needs to be fixed or changed, that we're not getting it right here. So what are we going to do? Again, these Californians are not alone. These Americans are not alone. Millions are paying the price for the President's broken promises. It should not be a political issue. It should be us serving the public. We cannot continue to stand by and watch as millions are losing their coverage that they want, that they shop for, that they were diligent about with people that are professionals that know what they're doing, unlike what we see with the people running the websites, which is only a small part of the whole big picture of what's wrong with this system. We need to set the egos aside, go back to the drawing board, at the very least, set this aside for a year. I believe we should repeal it and go back to targeting the people that really do need the help, and let the folks in this country that are already reasonably happy with their plan, have done the diligence, have made the effort to get the coverage and be responsible Americans. They don't need to be bothered in this scenario. Let's help the people that need the help. The American Health Care Reform Act was put over by Republican Study Committee is one way to do that. So let's look for alternatives. We have alternatives. We've had them all along, as Republicans, as conservatives, as people that understand business. And so let's make these choices available to the American public, not force them into something that they never asked for other than for political purposes. Mr. Speaker, I yield back.
The gentleman's time has expired. Pursuant to Clause 12A of Rule 1, the Chair declares the House in recess until noon today.
The House returns at noon Eastern for legislative work. They're considering a number of bills this week dealing with energy development and regulations. This afternoon they plan to finish debate on increasing oil and gas drilling on federal land and begin work on hydraulic fracturing. That bill gives state fracking regulations priority over federal rules. Also today, limiting the federal permitting process for natural gas pipelines. Debate on that bill will continue tomorrow. We'll have the House debate live when they return at noon here on C-SPAN. Meanwhile today, Florida Republican Henry Trey Radel pleaded guilty to a misdemeanor charge of cocaine possession and was sentenced to a year's probation.